Hi, my name is Stephanie Mittauer. I'm a family nurse practitioner and a psychiatric mental health nurse practitioner. I've been practicing as a family nurse practitioner for about 9 years and a psychiatric nurse practitioner for 7 years. What led me to become a psychiatric nurse practitioner kind of goes back to the very beginning of my career. My very first degree was in social work. So I did social work for a period of time and then was just trying to navigate life a little bit and figure out what else that I wanted to do. And I always knew I wanted to do something in the medical field. So I went back to nursing school with the intention of becoming a psychiatric nurse practitioner. And the reason for that is because I knew I could still do the medical side of it, the diagnosing, the treating, and then implement that therapeutic side of social work. So it's kind of like it married both degrees. And I love that part of it because it's me now working with the whole person, and having this opportunity to work with children is even more amazing because this is exactly where I wanted to be. So there's many things that I love about working with children and families, but I'd have to say that one of the most rewarding things is to have the privilege to walk through childhood and adolescence with them and help them as they gain coping skills and learn how to be resilient and learn more self-awareness. And then in the end, I get the opportunity to see them as they grow into these strong, amazing, independent young adults. As a psychiatric nurse practitioner here at Bluebird Kids, I work from typically around the age of 4 or 5 up to 22 years old. All with psychiatry. We basically work with anxiety, depression, heavy with ADHD, autism spectrum disorder, and mood disorders. So it's a really wide range of psychiatric disorders and a really wide range of ages. We do the best that we can. We've got a great team here. We've got care coordinators, that help also with the resources and helping the families and the kids to get what they need. Yeah, how I help families that are really struggling or feeling overwhelmed, I think a big part of it is resources, right? So I obviously allow them to come in, give a listening ear. I think that's a huge part of it. They just want to be heard. They feel alone, and I just kind of validate their feelings and let them know that they're not alone in this. A lot of kids and parents struggle with the same situations and challenges. And then I just kind of guide them. I let them know that we're here. We have people that can help. I'm happy to help. And then we give them the resources that they need. We provide them what we can do to help them to feel pretty confident as they're moving forward in the journey. So one of the biggest pieces of advice that I would give to a parent or caregiver would be, when your child comes to you with a problem, ask them, do you want my advice or do you just want to vent? And I think that this is really important because a lot of times as parents, and I know this for myself too, we want to fix everything. We want to say, oh my gosh, something's wrong. What can we do to help? How can we go into the school and fix this? Sometimes the kids just want to vent. They just want to tell you, I had a bad day, right? This is what somebody's doing. So if we allow them to kind of work through this on their own and talk through it, sometimes they can figure it out on their own. So I think it's really important, and it actually helps to build a stronger relationship so the parents can feel like, okay, we can kind of work through this together, and the child feels like mom or dad, they're there to listen. So all of these things are super important, and I think it's really important that parents understand and the kids understand that in order to have good mental health, you have to have good self-care.